Aloha, everyone, and welcome to our 152 review for the lab final. Again, this is for Chaminade University's Anatomy 2 Lab Final Review Guide. I'm mainly just going to be covering the figures as I've pretty much covered a lot of these. This is the same study guides that we've been using for the other lecture reviews, and so I feel like we've really hit home the actual text, but I'm going to mainly focus on the figures here just because these are the exact figures that you are going to see. Just to talk about the structure, as usual, 70% of the exam is going to come from the images and 30% is going to come from questions. Those questions will come from the textbook information as well as what's here available in the summarized and the study guides are generally going to be one and the same. With the new stuff that's been introduced here that you haven't seen in the previous study guides is going to be these figures which come directly from your lab manuals as opposed to the figures that come from your course textbook. So these are the lymphatic system figures that you are going to see on the lab exam, and just like the previous lab exams, it's going to be de-identified, so all of these labels are going to be removed, and you're going to be seeing A, B, C, and D, or ABC, or however many points each of these figures is worth, and I can't quite remember how much each of them is worth, but you'll be able to use this as a blank test site. So what I would suggest is taking this and covering up the labels using a Post-it or something, and then going ahead and filling each one of these lines in and making sure that you do know what each of these are. So this image here is referring to the lymphatic system. Of course, we're talking about lymphatic system drainage. So where the lymphatic system is going to come into, and this shows that the right thoracic duct is going to take 25% of the drainage, and the left thoracic duct, which is just known as the thoracic duct, the right lymphatic duct is 1/4, and the left lymphatic, which is just known as the thoracic duct, is going to be 3/4, and they're all going to drain here in between this left internal jugular and the left subclavian for that one, or here the right internal jugular and the right subclavian. This is a structure of a lymph node, and we want you to know that we obviously are going to have a medulla and a cortex, right? And so the medulla is going to be further in, cortex is going to be further out, and surrounding that we have this region here, which is the capsule. Lymphatic fluid is going to flow in from the afferent vessels into this nodular space, or that subcapular space. It's going to flow through these structures called trabeculae, going to get filtered past a ton of macrophages and other lymphatic through this lymphatic tissue. It's going to get filtered through different types of, again, macrophages and other types of immune cells like T cells and B cells that can destroy invading microbes. So here's just a cross section of a lymph node. All right, again, we also are going to have blood flow here. So there's a capillary, it's the outer capsular layer, subcapsular space, outer cortex, then the germinal cortex, then we'll get into the medulla. And then eventually, after all those filtration layers where anything that might be a foreign organism or a microbe that's invading has been destroyed, then it will leave out through these afferent vessels and then continue on for drainage back into the circulatory system. All right, again, I'm going to skip most of the text simply because I've covered the text previously. So what I would like you to do for this text information is to go back either to my lectures or to the review for the course exams, because I've covered all of this review guide pretty extensively, including the function of the lymphatic system, etc. So I'm really mainly going to focus here on the images simply because I just did the review session for reproduction, etc. All right, so those are going to be the images that you'll need to know for the lymphatic system. And the images that you'll need to have for, let's see, for the digestive system. So I basically front loaded all of the images in front of the text that is all, again, the study guide that you've seen previously. These are the digestive systems that I'm going to be using, again, completely de-identified. So you're going to need to know all of the different major organs of the digestive system, including which ones are the major organs and which ones are the accessory organs. So make sure that you can identify things like the liver, the gallbladder, and the pancreas, which are not actually digestive organs but provide digestive enzymes to the digestive tract throughout it, etc. Also, knowing the different layers of the digestive tract, right? Knowing that we have the serosa layer, the muscularis layer, submucosa, mucosal layers, and knowing how they change as we travel through the digestive tract is going to be important. This here is going to show you the layers of the intestinal wall. Again, it's all going to be completely identified, and you're going to have to tell me, I'm not sure exactly which ones I chose, but for example, which one is the um, let me make this a little bit bigger so you guys can see a little better. That might be a little bit too big. How about in here? Yeah, something like this. So then you might have to know which one, for example, is the mucosal gland versus the villi versus the mucosal epithelium or the submucosal plexus. In the mucosal layer, that's where we're going to have all of the exchange or the uptake absorption of nutrients. Underneath that submucosal layer, that's where we're going to have our blood supply and our lymphatic tissue. And our submucosal layer actually runs into these little lacteals, remember, that run up into that mucosal layer. And then outside of that, we have the musculaire layer. Usually we have two, right? Usually we have circular and longitudinal, but sometimes we have oblique if we're talking about, for example, the stomach. So we might have an extra muscularis layer. And then underneath that, we have the serosa layer, right? So that's going to be the major layers. And we're going to have those layers all the way through the digestive tract. And they're going to change a little bit as we're talking about digestion of different nutrients, right? They're going to change in the stomach for the to the small intestines, for example, and from the small to the large intestines. But those layers are still going to remain intact, even though they might change a bit. Again, we're going to de-identify everything here. You might have to identify which one is the transverse colon versus the descending colon, or the greater omentum and the lesser omentum, right? So anything on these images are going to be totally fair game. So the falciform ligament is going to be what divides the liver. It's going to be found right here as we do this cross section. We also have a ton of these different transverse sections of the mesocolon and the colon. Here's going to be the omentum here, and the mesentery is going to be the connective tissue that attaches it to the back of the abdominal cavity, where the omentum is going to, and the peritoneum are going to attach it to the front. Well, the omentum attaches it to the front, and the peritoneum just kind of basically holds everything in place. So yeah, any of these on these images are going to be fair game, de-identified, and then labeled as A, B, C, D, and then you're going to have a word bank of all of the options of the words that are here present, and the drop-down menu are going to be your choices. So this is the stomach. This is where I told you we got that extra layer of muscles. So some of the things that we have in all layers, right? We're going to have the serosa and the mucosa layers, etc. But here we have extra muscularis layers. So here we're going to have the circular muscle layer, the longitudinal muscle layer, and then also an oblique muscle layer, which is going to overlie that mucosal layer. At the top, we're going to have the fundus. So we're coming down through the esophagus. Then we're going to enter into the lower esophageal sphincter, which allows the food into the stomach. Then we have the fundus. Then we have the body. At the bottom, we're going to have the pylorus. The pyloric antrum is what going to lead into the pyloric canal. The pyloric canal is, of course, what is going to lead us to the pyloric sphincter, and that is going to be where we enter into the small intestine. So here's the duodenum, which is going to be the entry into the small intestines. And food's going to come in large, a bolus, for example, like many bites, an entire meal, perhaps, is going to sit here and stretch all those, but only a small amount is going to come out. Right, we're going to lose about 1 to 2 tablespoons out here into the duodenum at a time, and that's going to be really important because it's going to be really acidic in here, and we want to neutralize that pH here. So we need to bring a little bit of chyme over at a time, and then we can add different buffers that can help bring our pH a little bit closer to neutral. All right, so here is an up-close view of the stomach and the mucosal layers, right? So this is going to be a diagram, and then this is actually like an image, right? A light microscopic image. And what we're seeing in both is that we have these rugae, and inside the rugae we have these gastric pits. So the gastric pits are going to be an opening, basically, where the gastric glands are going to be secreting out. And inside those gastric glands, we have a ton of different cells, namely the parietal cells. Remember, these are going to be really important because they secrete hydrochloric acid, but also chief cells, mucous neck cells, etc. These are all going to secrete gastric juices, which are going to come up into the lumen, right? So you'll need to know all of these different terminology, including which muscle layers, the oblique muscle layer, circular, longitudinal layer. So as I mentioned previously, we're going to always have the same layers, the mucosal layer, submucosal, muscularis, serosa layer, but they're going to change as we pass through the different structures of the digestive tracts. Right, so all of these images are the exact images that you are going to see de-identified when you take the exam. So make sure that you practice, make sure that you lay, again, a post-it note along the side and cover up cover up these, and then sit there and make sure that you can test yourself by memorizing it. All right. So this here is looking at the small intestines. So now again, we're going to see the same layers: serosa, muscularis, submucosa, mucosa. But in this case, now we're going to see a little bit different. So instead of those gastric pits, now we're starting to see these villi with lacteals inside. The lacteal is going to be the area that we're going to be picking up our fats. So a lot of things are going to be able to come and be picked up by the bloodstream, but things like fats are going to have to be transported, or other very large biomolecules are going to have to be transported through the lymphatic fluid, which is found in these lacteal regions, right? So this is the up-close view of a villus, and just kind of showing you the different mucus cells. For the brush border cells, there's going to be brush border enzymes on there, etc. Again, here we're also going to have always vasculature, nervous tissue, and lymphatic tissue running through that layer here, that mucosal layer. All right. So now we're talking about the liver. So it's talking about the anatomy of the liver. Again, this will be the exact image, just de-identified. We have a right lobe and a left lobe, and underneath that we have a gallbladder. So the liver makes digestive enzymes that are going to get stored in the gallbladder that are then going to get released into the small intestines when necessary to aid with digestion. So here's the right lobe of the liver and the left lobe of the liver. Again, they are separated by the falciform ligament here and the coronary ligament at the top. So falciform ligament runs into the round ligament more on the inferior side. On the superior side, we have the coronary ligament. We also are going to have the hepatic vein, which is going to be feeding into the liver. And then, sorry, that's here. And then here's the vena cava, which is going to feed obviously directly into the heart. All right, moving on. This is up close and personal about how the liver and the gallbladder are all going to secrete their fluids into the duodenum, which is in the small intestines. So here we have the gallbladder. Here's the fundus, the body, and the neck. It's going to be a storage organ for the liver, which of course produces bile. So the liver's bile is going to get stored in the gallbladder, and then the gallbladder is going to secrete it into the duodenum when necessary. It's also going to enter in with fluid coming directly from the pancreas. So pancreatic enzymes are also going to be entering in here into the duct that's going to secrete bile from the liver into the gallbladder and into the duodenum of the intestines. Again, the pancreatic duct is going to be found right there as well. Some of the vasculature, you have the hepatic portal vein, common hepatic artery, gastric artery, etc. And then, yeah, the hepatic duct is going to be what connects actually from the liver into the gallbladder. All right, so this is what I was saying when I said that we had a region where we had the bile duct and the pancreatic duct coming together. This is going to be the hepatopancreatic sphincter is what's going to basically open or close this duodenal ampulla, which allows the fluid out into the duodenum. So here's the common bile duct and the pancreatic duct. Again, they're going to come together here at the hepatopancreatic sphincter, which then is going to either open or close. All right. Let's see. So those are going to be all of the images for the digestive tract. Then again, you can find all of this information in the review sessions for the exam that covered this material as well as for each of these lectures. So I'm just going to be basically focusing mainly here on the images that you're going to need to know. All right, so we're going to move on past this. Again, I know it's a really long document, but you've seen all of these files before. Okay, so now we're getting into the renal system and the urinary system. So the first thing we're going to show you is the kidney. So here's the diagram of a frontal section through the kidney. And the first thing that you're going to see, of course, is going to be the cortex, that outer layer, and then the medulla is the inner layer. The medulla layer is going to have these renal pyramid layers as well as renal columns. So the renal columns are going to be in between the renal pyramids. And the renal pyramids are going to be where we have the nephrons and nephron loops. That's where the urine's actually going to be concentrated and created. Then it's going to drain into the minor calyx, minor calyx, etc., into the greater calyx, or the major calyx here. And then the major calyx is going to drain into the renal pelvis. And then from the renal pelvis, we'll exit out through the hilum to the ureter, which is where we're going to drain into the bladder. Okay, and that's going to look like this inside a cadaver tissue. And again, any of this as de-identified imagery is going to be completely fair game. All right, this is talking about how we actually are going to concentrate the urine. So here we have the, so it's going to be a up close and personal section of the kidney, basically going from the outside in. So here we have the cortex. Here we have the medulla. We're going to have these nephron loops. Here we have the smaller nephron and then deep nephron. And these are basically going to be different ways by which we can concentrate either dilute or concentrated urine. And basically what happens, here's the renal corpuscle, and here we're going to have filtrate that's then going to go out into the proximal convoluted tubule down into and then back up. Then here we're going to have the connecting tubules, which bring us into the collecting duct, into the papillary ducts and the renal papilla. And that's what's going to actually exit out into the minor calyx. So that's what's actually happening inside these renal pyramids, basically, right? And again, any of that de-identified is completely fair game. Here's looking at a glomerular capsule. So this is how we're filtering the blood to be able to create the urine. Note here that we have the blood supply here, afferent arterial. So that's where the blood's coming in. That blood is then going to end up into this capsular region where we have specialty cells, right? This type of cell is called a podocyte from the visceral epithelium. It's going to wrap around, and there's going to be little holes inside there, the filtration slits, and what they're going to be filled in. Basically, the gaps are going to be in between what's called the pedicel region of these podocytes. And that means that fluid's going to be coming out. And we talked about different types of pressure. Basically, it has to do with the pressure in versus pressure out. It's going to be a net filtration pressure. And eventually, we have pressure going outward, meaning that fluid leaks out into the proximal convoluted tubule. Some fluid leaks out, some fluid leaks in, and most things are going to be resorbed. That means that mainly what's going to flow out is going to be salts and waters and urea. That's not going to be covered there. Again, they're just going to be these de-identified images. Of course, the other thing you need to know, this is the, again, this is the capsule, the capsular space. I didn't talk about that. I apologize. And the capsular epithelium is this juxtaglomerular complex. So that's what I was going to talk about. This is the macula densa region. And these are the juxtaglomerular cells that go right next to this juxtaglomerular complex, right? And so that's going to be something that it's not going to be covered, I don't think, in depth, but you are going to need to know at least for that image. All right, so now we're going to be talking about urine storage and transport. So remember, urine is going to be stored in the bladder. It's going to come down from the ureter and be stored in the urinary bladder. But these are also the same organs that we're going to be looking at when we're looking at reproduction. So let's just take a look and pick out some other things here as well. So for example, the urethra. The urethra is going to have 3 different regions to it, including the spongy urethra, intermediate urethra, and the prostatic urethra, which is where the urine is going to come out of when it's released from the urinary bladder. But it's also going to allow for seminal secretions to come out from say, the vas deferens, the prostate, the seminal fluids, etc., during the process of ejaculation. All right, so what else do we see here? We see the external sphincter. We have an internal sphincter as well. It's going to allow us to release urine or during the process of micturition, which is the voluntary release of urine. And then, let's see, here's the external urethral orifice. So that's where we're going to be releasing the urine. In a female, it's very similar, except we have much smaller urethras than do men. That means, and also our reproductive system is disconnected. So we're going to have an absolutely separate entrance for the reproductive system, whereas men, our reproductive system is going to be connected to the urethra. There's a vestibule. We have the external urethral sphincter, the internal urethral sphincter. Again, voluntary control, involuntary control. And then we have the urinary bladder, which of course when it fills up is going to cause pressure on the internal urethral sphincter, causing it to expand. Surrounding that, we're going to have the uterus. This is going to be the ovary and the fallopian tubes. We also are going to have here the ureter, which is going to be descending down from the kidney, and the rectum, which is of course for the process of defecation, and then the anus for that as well. So again, those are all of the images that you're going to see. Again, they'll be de-identified, but any words that are on here are going to be given in the word bank and are going to be offered as a drop down, and you're just going to have to pick the correct item from the drop down for A, B, C, and D. And you've all done pretty well on these before, so I don't think I have to explain how it works to you. All right, so we're going to move on now to reproductive system, starting with the male reproductive system. And I know this is going to seem really redundant since we just did the reproductive system intensive lecture. So if you want to hear the long version, go to the course review. But again, I'm just going to be focusing here on the images. Okay, so here is a mid-sagittal section of the reproductive organs of a male. It means we're going to go right through the middle. Again, the urethra has 3 different regions, including the prostatic urethra, the intermediate urethra, and the spongy urethra. Those are all not identified here, but they're going to connect to the urinary bladder, but also going to connect the ejaculatory duct. The ejaculatory duct is going to connect to the vas deferens, as well as the prostate, as well as the seminal vesicles, and we're going to get fluid from all of these regions, including the bulbourethral glands, which is going to help with lubrication, etc. All of that's going to end up in the ejaculate, which can end up through the spongy urethra. Now, the bulbourethral gland secretions usually come out a little bit earlier because it's going to help with lubrication, etc. Although sometimes they can have sperm still in the channel, so sometimes it's called pre-cum. It can actually have sperm in it and can actually get you pregnant, even though it is just lubrication generally from the bulbourethral glands. What else am I missing? So the vas deferens, I know I talked about, but I'm not sure I identified here. So the ductus deferens is going to, let me start with the testes. Here's the testes, which is where sperm are created and stored for a short while until they enter into the epididymis. During the epididymis, they are going to mature. So here's the caput, corpus, and caudal epididymis. From the caudal epididymis, they exit out through the vas deferens. The vas deferens is going to be able to go up and over, so it's going to enter into the body cavity. Does that through the spermatic cord. It's going to go up and over the urinary bladder and then back down behind the ureters to enter into the urethra, right? So it's actually kind of a long route that it has to travel. All right, we also are going to note that we have two different types of penile erectile tissue, including the corpus cavernosum tissue and the corpus spongiosum. We have two corpus caveosum, one corpus spongiosum, and through that corpus spongiosum is where the spongy urethra is going to run, right? So it's not actually going to be secreted from the middle, although at the tip it will be secreted from what looks like the middle, but it's actually going to run along the bottom. Alrighty. I would ask any questions on that, but no one is here, so I will continue on. This is showing another view of the male reproductive system, including the scrotum. Remember, the region that's going to be the intersection of the bottom of the two different testicular caps is going to be the raphe, so where the skin is going to be, and the top of that, that's where we're going to have the cremaster muscle, right? So the cremaster muscle is going to be running right along here. What else am I missing? So we have the spermatic cord. In the spermatic cord, we have a lot of things, including nerves, arteries, vas deferens. So vasculature and nervous tissue and the vas def are all going to run right through that spermatic cord. We're also going to have some muscles that run through there as well, including the cremaster muscle is going to run up along inside of that as well. So you can see the cremaster muscle runs shoop, right up in there. Where's the dartos muscle? Which I don't see here. Okay, we're a little bit in the layers of the scrotum. So the dartos muscle is going to be this muscle here, and it's going to be involved in testicular ascent and descent. It's going to lie right on top of the scrotal skin and just beneath the testes themselves. Here's the testes. The testes are covered by a layer called tunica vaginalis. And then we also are going to have the epididymis. The epididymis has the caput, corpus, and caudal layer that's going to connect directly to the vas deferens, which of course is going to run through the spermatic cord, right, and up through the inguinal canal. And I think that I have touched on everything in this image. I have. All right, so again, it'll be de-identified, but it'll be the exact images that you see. All right, continuing on with the male reproductive system. Again, this exact image, but de-identified. We will have to identify, here's the corpus cavernosa. There's two of them. Inside this corpus cavernosa, it's basically just a spongy tissue. Same with the spongy tissue here, this corpus spongiosum, that's going to all be able to pool with blood. Once this deep artery of the penis is given blood, it's fairly leaky. It's going to fill up that and going to cause the erection itself. We're also going to have dorsal artery, the veins, and nervous tissue that are depicted right here that are going to be at the very top of the penis as well. Or the superior section, I suppose. Here's the urinary bladder. The urinary bladder obviously has ureters that are going to connect to the kidney. But here's the vas deferens, which is going to, I'll start with the testes. Here's the testes. Sperm are created and stored for a short while. Then they enter into the epididymis for 14 days of epididymal transit, where they enter into maturation. From there, they're going to get ejaculated out through the vas deferens. The vas deferens goes up through the inguinal canal, up over the back of the bladder, and down into the urethra, where it's going to be met by the prostate, fluids from the prostate gland, as well as fluids from the seminal vesicles, as well as fluids from the bulbourethral gland. All of that's going to enter into this spongy urethra. Right, and we're going to exit out through the external urethral orifice, which is at the tip, or the glans penis. The corona of the glans penis is going to be this region here. Again, that's depicted there. And if this individual is not circumcised, then we're going to have this region here called the prepubis, or the foreskin. All right, again, the erectile tissue is the corpus spongiosum and the corpus cavernosum. And if we do a cross section, that's what that looks like here. We already talked about that. And I think I've touched on everything there as well. I just might not have really touched on it. I think I've touched on everything except the right crucis. This crucis is just going to be the connection area where the penile tissue is going to interact with the inner thigh. All right, so the next one that we're going to talk about in the male reproductive system before we talk about female reproduction is going to be the process of spermatogenesis. So spermatid here, are created during the process of spermatogenesis. This occurs in the testes. Occurs in the seminiferous tubules. From the seminiferous tubules, they go through the straight tubules to the rete testes, and then out to the epididymis. But this is going to be a cross-section through the seminiferous tubule. Here's the lumen. Here on the outside, we have dividing spermatocytes. We have nurturing cells or Leydig cells, these nurse cells here that are going to help feed the spermatids. And then the dividing spermatocytes are going to come out of a spermatogonium. There we go. A spermatogonium is going to be the precursor cell. That's going to undergo one division whereby it restores its own spermatogonia, and then one that is going to enter into the process of division. The dividing spermatocytes are eventually going to end up separated out and released into the lumen. From the lumen, they're going to go out of the seminiferous tubules into the straight tubules, and then they'll be released into the rete testes. Again, we're showing kind of the same thing here, but a little bit more up close. So here is the tissue capsule around side here. It's a fibroblast layer. And then inside there, we're going to have these are the nurse cells. These nurse cells are going to be the cells that are going to help basically feed the developing cells. Here we have the blood-testis barrier actually is going to go right there as well. It's similar to the blood-brain barrier that's going to help prevent certain things from crossing into or out of the testes. It's actually been kind of a barrier to certain testicular cancer drugs because it's really hard to get things across the testes barrier. But I digress. My point is that first we start with this primary spermatocyte, then we get a secondary spermatocyte, finally we get a spermatid, and eventually a spermatozoa. All right. Any questions? Nope, nobody's here. All right, reproductive system for the female. Moving on. Here's our female reproductive system. We're basically going to be taking a look at the inside of this female. Here is our ovary. The ovary is going to release an egg that's going to enter into this. Here is the uterine tube or the fallopian tube that's going to connect to the uterus itself, which is down in here. For instance, the actual site of fertilization is going to be in this fallopian tube, and then the fertilized zygote is going to travel down, become a morula, become a blastocyst, and implant inside the endometrial layer of the uterus. So this here is the uterus. The uterus sits right on top of the urinary bladder. And then that's going to be right on top of the pubic symphysis, which is the bone itself here. Some accessory glands in the female reproductive system are going to include the paraurethral glands, the vestibular glands, and these are going to be involved in secretions of both lubricant as well as antimicrobial enzymes because it is, of course, an external orifice. The external genitalia are going to include the labia majora and the labia minora. The singular is going to be minus and majus, but plural is going to be minora and majora, which is pretty much how you're always going to hear it. It's weird to see it singular. And then this here is the vagina. So again, urinary bladder, urethra, sorry, urinary bladder, urethra. And then here is the uterus. Here's the cervix. We have the internal and external cervical os. Then we have the vagina, and then the vagina has an external vaginal opening for the external orifice. All right, in the uterus, we have three layers, the parametrium, myometrium, endometrium. Endometrium is the innermost layer, which is going to get thicker and then slough off and thicken and slough off in a monthly cycle known as menstruation if fertilization does not occur. And as soon as fertilization does occur, the embryo will implant in the endometrium, which will then become the decidua. So it no longer becomes is called the endometrium once fertilization and implantation have taken place. Okay, so I've touched on everything in that slide as well. Again, all these are just going to be de-identified pictures, and you're just going to have to know what they are when I label them A, B, C, and D. Okay, so again, here is the ovary. The ovary is right next to, juxtaposed to, but not exactly attached to the uterine tube. Is the infundibulum of the uterine tube where the fertilization is going to be occurring, and then the fertilized, now it's going to be called a zygote at the first stage, then it becomes a morula, and then it becomes a blastocyst when it's going to implant in the uterus. The uterus is going to be held in place by several ligaments. Here's the broad ligament, looks kind of like bat wings anatomically. And then we also are going to have ligaments that are going to hold the ovaries in place. Here's the ovarian ligament, and then the mesovarium is going to basically be the continuation of the broad ligament that is going to continue on beyond the ovary, and then also connect up to the uterine tube. And on this side, we're going to have the suspensory ligament, which is basically going to be the other ligament holding the ovaries in place. So the ovaries are held in place by the suspensory ligament and the ovarian ligament, and that holds them directly in position with the uterine tube. So although they are not actually connected, they're both connected to the same connective tissue. So they are juxtaposed to one another, but there is still a leap that the egg has to make every month from the ovary into the, across into the fimbriae, I guess, into this uterine tube. All right, again, this is the uterus. Here's the cervix. The cervix is an external os and an internal os. People will take a look at the external os to figure out the thermosymptal method when they're trying to figure out when ovulation is occurring, because the cervical mucus changes throughout the month, similar to the way the endometrial layer is going to change throughout the month, all depending on the context clues and the hormonal regulation. Here's our vaginal ruga, a vaginal wall. See what else is, oh, so the ureter, obviously, this is going to be for urination. It's going to be where the urinary bladder is going to be connecting. So it's going to connect down into the urinary bladder, which of course is beneath the uterus. Here's the utosacral ligament, which is holding that together into the sacrum. The other thing of interest here is going to be the ovary. So here we have a cross section of the ovary where we're able to see the different stages of ovaries, including the early eggs, germinal epithelium, mature follicle, which is known as a graphium follicle, and then that's going to rupture and turn into the corpus luteum. The corpus luteum sustains the endometrial layer until pregnancy is determined to have occurred. If it's determined to have not occurred, then it becomes the um, albuginica, right, which I guess is not shown here. We also are going to have a cortex and a medulla, so an outer layer and intimate layer. You're going to see this obviously with a lot of different organs. And we're showing you here that the ovary is very close to the uterine tube, but not directly connected, right? So if you did a cross section, it still has to make a leap, although actually the leap would kind of be more like this, three-dimensionally, see like that. All right. Yeah, so that's it for that section, or for that image. Again, here is the ovary. The ovary is connected to the uterine tube. The uterine tube has 4 major regions, including the fimbriae, which is going to be right outside of, juxtaposed to, hopefully catching that oocyte. Then we have the infundibulum, which is here. Then the ampulla and the isthmus. The isthmus is going to lead into the uterine cavity. And then in the uterine cavity, we're then going to enter into the cervical canal. We have the internal and the external cervical os and the vagina. All right. Again, the uterus is split up into 3 major layers. Parametrium is the outer layer. Myometrium is the muscular layer in the middle. Endometrium is the layer that sloughs off every month. And this is going to stop being called the endometrium as soon as pregnancy occurs, and is going to start being called, again, the decidua. Fundus of the uterus, body of the uterus, isthmus of the uterus, leading into the cervical canal. Again, uterine tube with the fimbriae has several different things. Fimbriae, infundibulum, ampulla, isthmus, right? Fimbriae, infundibula, ampullum, isthmus, heading into the uterus. All right, so that's all kind of the same stuff we saw with the other image. Now, here is a view of the ligaments. So this is what's basically showing you how everything is stabilized inside the pelvic cavity. That's going to include the ovarian ligament, which is going to hold the ovary in place in one direction, and the suspensory ligament of the ovary, which holds the ovary in place in the other. So suspensory, ovarian, ovarian. We are also going to be looking at the uterosacral ligament, which holds the uterus in place to the sacral region. And then we have the cardinal ligaments, which are found underneath the broad ligaments. You can't really see it. Here's the broad ligament, which again looks kind of like a bat wings a little bit. And then the round ligament of the uterus here. So there's a lot of different ligaments that hold these structures in place. So although these are all soft organs, they're all going to be held in relative location to one another by a very intense ligament network. All right, moving on. Again, we're still female reproduction, but now we're talking about the process of lactation. These are mammary glands. We have lobules of the mammary glands. So here's 2 lobes, right? Lobe 1, lobe 2. So lobe is this whole thing. Lobules are these small little grape-like things. And the lobules of the mammary glands are going to secrete milk. They then are going to go out the lactiferous duct. That then are going to be secreted out through the lactiferous sinus, out through the nipple. All right, we also are going to have a ton of fat pads here. And these are going to increase during pregnancy as well as the actual size of the lobules, which are going to be filling with milk. Okay, this is going to be looking at the ovary. And we're going to start with the primordial follicle, which is going to be halted so that's going to be halted in meiosis 1 at infancy. Then we're going to wait about 13 years, and we're going to enter into puberty, and then we're going to start creating mature follicles. So then it'll become a primary follicle, a secondary follicle, tertiary follicle, and eventually a ruptured oocyte. This ruptured oocyte is going to be surrounded by cumulus cells known as the corona radiata, and that's going to be the last barrier that sperm have to swim through before they're able to actually get to the zona pellucida in order to fertilize the egg. After this follicle is ruptured and the oocyte is released, it becomes the corpus luteum. The corpus luteum secretes hormones like progesterone and estrogen that are going to keep that endometrial layer nice and thick and fluffy, in the hopes that that embryo is going to actually be an embryo, right? The fertilization event did occur, and we do have a zygote, which is going to become a morula and then a blastocyst and then implants. If that implantation event does not occur and HCG does not tell this corpus luteum to continue on, indicating pregnancy has occurred, then it becomes a corpus albicans. It stops the release of progesterones and estrogens, and that's going to indicate to the uterine lining that we should shed the endometrial layer and then start over next month. All right, so those are the images for reproduction. Again, if you want to hear the reproductive talk, please listen to my just this earlier this afternoon lecture for the final exam for the course, or for the 5th exam for the course. Alrighty, here we go. So the next thing will be with development. So here we are with development inheritance, and these are the exact figures that you're going to see. Again, these are going to be de-identified. So you will have to identify what is occurring or which of these is present where, etc. So the very first thing that happens is the oocyte is actually ovulated. That means that we have the rupture. Well, I mean, the very first thing that happens is the oocyte develops in the ovary, but when we actually have the rupture, so the very first step of fertilization is the rupture of the oocyte, that's going to leave the actual ovary and get picked up by the fimbriae, the uterine of the uterine tube. And originally, it's going to be surrounded again by the zona pellucida and by the corona radiata. So I initially had said that we have a tennis ball. The tennis ball is covered in a nylon layer. That nylon layer is surrounded by a bunch of marbles that are held together by peanut butter. And then the sperm have to swim through the peanut butter to get to the nylon layer. The very first sperm to get to that nylon layer, the nylon is going to become a iron fortress, so no more sperm can come in. That's called the blocked polyspermy. And this is going to be the actual spermatozoon that does the fertilization. At that point, we're going to have a second polar body. So the first polar body, a second polar body is created. Those two polar bodies are going to slip off, and then we're going to end up with the combination of the male pronucleus and the female pronucleus. So here is the male the sperm's head is going to make it in, not the tail piece, not the neck piece, so no mitochondria. And then that head is going to decondense, so that's a pronuclei. And then these two male and female pronuclei are going to come together to cause the first cleavage event. So first we're going to make the zygote. That happens about 30 hours after fertilization, and at that point, then we're going to enter into the metaphase of the first cleavage division, right? So this is the beginning of the first cleavage division, the secondary, and then eventually we're going to enter into cleavage, right? So that's how this happens. Basically, we have the first cleavage division, which occurs, that's going to happen at day 0, just at fertilization event. That's going to happen early on. Day 1, we have 2 cells, then 4 cells, then eventually we end up with what's called a morula. So that 2 and 4 cell stage is called a blastomere. That morula is going to turn into a blastocyst. But what's interesting is that the size of this egg does not change. I'm sorry, the size of this embryo does not change from the fertilized egg all the way through until we hit the blastocyst stage. So the morula, early morula, 4 cells, 2 cell stage, it's just getting smaller and smaller cells. But it's still going to remain the same. And it's going to be rolling on down through that uterine tube until it finally becomes a blastocyst. The blastocyst is known as the blastocyst because it has what's called an inner cell mass. And then that outer trophoblast layer. We also have an area here known as the blastocele, which is an open layer or an open hollow cavity. Now this inner cell mass is what's going to become the embryo. And this outer cell mass, this trophoblast layer, is what's going to become the fetal associated tissues like the placenta. All right, so this here is showing implantation. So here's the blastocyst. The blastocyst is going to encounter a nice thick layer of endometrium. In this thick endometrial layer, this blastocyst is going to find a nice bed to embed itself. That inner cell mass is going to orient itself towards the endometrial layer and then eventually invade. Here we have the syncytial trophoblast layer, which is going to be the outer layer of the cellular and the cellular trophoblast layer. So those two layers are going to become the fetal associated tissues, such as the placenta. So you can see they're already kind of invading into the endometrium, which again, at this point is now going to become the decidua as soon as implantation occurs. This is now becoming the amniotic cavity, and these are called lacuna, or large spaces. We've seen them before when we were looking in the bone, right? And these spaces are going to eventually be able to be filled with maternal blood. So that's going to be the precursor, the early precursor to the placental layer. All right, around day 10, we're going to form the yolk sac. The yolk sac is what's going to be supporting the embryo in terms of nutrition until the placenta is able to allow for exchange between the maternal and the fetal blood supply, and nutrients are able to be fed to the developing embryo. At that point, actually, it's becoming a fetus. It's going to be called a fetus. Here again, we have those outer layers, the trophoblast layers. Here's the syncytial trophoblast layer and the cellular trophoblast layer. Inside we have the blastocoele. Here we have the amniotic cavity, and this is what's going to be the bilayer. It's going to be a bilayer disc. Here we have a yolk sac. Again, that's going to be nourishing the embryo, and outside embryo, and then outside we have the lacuna region, which is where the blood is going to be coming in. So again, the yolk sac is going to be responsible for distributing nutrients released into the blastoqueal. And then the next stage is going to be gastrulation. So gastrulation happens when we're going to have this invagination event. We're going to be determining which part is going to be the head, which part is the tail. That's going to be determining the primitive streak. And that's going to give us 3 distinct layers, the ectoderm, the mesoderm, and the endoderm. So previously we just had 2. We had the ecto and the endoderm. Now all of a sudden we have the mesoderm, which is going to be invading in between. So the mesoderm kind of comes in from the side, and while this invagination is occurring, there's also an invasion of mesoderm layer. And that's going to, again, form the primitive streak and make it so that we have a 3-layered embryo now. Again, ecto, meso, and endoderm, which are going to become the outer, the middle, and the inner layers of tissue. Again, that's a process called gastrulation. All right, this shows you the early stages in the first trimester. Here's the pharyngeal arches, which we spoke about in the last review session, which are going to become the pharynx. They're going to have precursors to cartilage in there. Here's the developing forebrain, the developing eye, developing ear. The developing heart has a nice little heart outpouching, and that's because the heart's going to have a couple different folds that have to happen in order to be able to go from these 2, it's just originally 2 cardiac streaks, basically, that then come together and then fold and invaginate a couple of times. So there's a little heart outpouching that has to allow for the space for that activity to occur. We also have these somites here. Somites are precursors to vertebrae, so they're going to be ways in which we can age, basically say the gestational age of an embryo, because there's specific time points at which each somite turns on. Additionally, we're just starting here at week 4. We've got the arm bud, but we don't have any. We have limb buds, starting the leg bud and the arm bud, but we don't have any hand buds yet. We'll get those shortly, and then eventually we'll get finger buds. All right, but I'm backtracking here. So here's week 2. We were just showing week 4, so we're kind of at the same time frame. So between week 2 and week 3, where that disc is going to start changing a little bit. So we're going to start ending up with these different layers here are going to be kind of differentiating. So here's the mesoderm, which is going to become the yolk sac, right? The amnion, which is still here. It's present right there, including the amniotic cavity. And then we have this region here, which is going to be that middle region, which is going to become the alointus. The alointus is going to be a precursor to the umbilical cord. Okay, it's going to be a connective layer whereby the fetus, which is developing in this amniotic cavity with the amniotic fluid, again, it's an embryo, not a fetus yet, but it's going to be connected to the chorion, and the chorion is going to be a layer of the maternal interface, the maternal fetal interface, which is going to become the placenta. All right, we have chorionic villi of the placenta, which are going to allow for a barrier between the maternal and the fetal blood supply, but still allow for nutrient exchange. Again, we're not going to get there until about week 8 or 9, but we are starting to create it as early as week 2. All right, so here we are at week 5. At this point, now we are developing a couple of extra things. So first of all, we're going to have the embryo and the embryonic membranes are going to bulge out into the uterine cavity. So now we're not just implanted into the decidua, but now we're actually bulging outward. And we also are going to have the trophoblast is going to be covered by the endometrium, but it doesn't in any way participate in nutrient absorption or support the embryo anymore. Plus, the yolk stalk is going to be fusing to form an umbilical stalk. So the yolk stalk and the umbilical stalk are kind of coming together. And as we are losing our yolk sac, our placenta is being created. So the nutrients that are in the yolk sac are going to sustain until the placenta takes over. And that's why these two are going to merge together, because they are eventually going to become the umbilical cord here. All right, so what else am I not talking about? Here's the chorionic villi of the placenta, and then the different layers of the uterus. Here we're going to have the head fold versus the tail fold. So we're showing you it's a little bit more than a primitive streak. Now gastrulation has already occurred, but here's the head region, here's the tail region, here's the yolk sac. The yolk sac and the body stalk are going to be coming together in just a minute to become that, again, to become that umbilical cord. Is also going to be the way by which the embryo is fed. The embryo is currently fed by the yolk sac, but it's going to be taken over shortly by the placenta. So these two forming together means that then we're going to be able to have a smooth transition for the nutrient exchange in the embryo. The other thing that's interesting now is what's left of the yolk sac is then going to become the midgut I know that's not shown here, but that's actually going, so what is feeding it as a embryo is actually what's going to be the site of nutrient exchange in the a fully formed infant and adult. All right, this region is the deciduo parietalis. Remember, that's going to be the region that is not covering. So here's the decidua capsularis, the region that is covering the embryo. Decidua parietalis is the region that is not covering the embryo, but is still the decidua, which is previously the endometria, but isn't that anymore because implantation occurred. And then here's the decidua basalis, which is underneath the developing embryo. All right, so those are going to be the images that we're going to be using for development. Yeah, that's going to be everything, guys. All right, so I'm going to go back to the crowd and ask if there's any questions. I'm just kidding. No one's here. But if you do have any questions, go ahead and shoot me a text message or an email. And it has been an absolute pleasure having you guys in virtual class. I know it's been a really tough year, and I really appreciate that you guys have hung in there. You've all done extraordinarily well. Hang in there. You've got this. One more week of finals, and then you're done for the summer. All right? Cheers and happy studying. Take care. Bye-bye.